This is gonna blow your mind. Do you know the telltale signs of bronchiectasis? Let's dive in. Look for these key signs: a chronic productive cough, foul-smelling sputum, and recurrent infections. Diagnosis: confirm it with a high-resolution CT showing dilated bronchi. When it comes to treatment, start with antibiotics for infections. Don't forget chest physiotherapy, and consider bronchodilators to help your patients breathe easier. Closing, remember, no need to subscribe, but if you miss bronchiectasis on step 2, you might cough up the wrong answers. Stay sharp, and see you next time, docs.